now I have the pleasure to invite the first speaker. He's Dr. Indika Karunathilake, whom I know very well. Indika is the Director of Medical Education Development and Research at the Faculty of Medicine, University of Colombo, and he is a medical educationist with a very strong track record in his field. After graduating from the University of Colombo, he had did postgraduate studies in medical education at the University of Dundee, and since his return, he has been of yeoman service in the field of medical education to all universities in Sri Lanka and the Postgraduate Institute of Medicine. He's the editor-in-chief of the Southeast Asian Journal of Medical Education, and he is currently a vice president of the Sri Lanka Medical Association. I must say, although he is very much younger to me, I have learned a lot in medical education from him. In fact, when we modified our curriculum at Jawadanapura University, he was a real strength to us because he guided us on so many aspects. So Indika is going to speak to us on a very interesting topic, how to make teaching in health sciences simpler, more effective and enjoyable.
Thank you very much for that very kind introduction, sir. I feel very honored and humbled. And I would like to thank the organizing committee and especially Colonel Dr. Thamsi Makuloluwa. Again, I have worked with her for many years for inviting me for this very important conference. As it was mentioned by the chairperson, so it's an important topic. At the same time, it's a challenging topic to be discussed within a short time of 15 minutes, which I am very much cognizant about. So during this short presentation, I'll be providing an overview about how to make teaching and learning in health professions education simpler and more effective. Why do we need to address this? As we all know, the information explosion, the amount of information and evidence in medicine and healthcare, it has increased and has increased exponentially. And health professions education is very much dependent on this huge volume of information, evidence and facts. Again, this is one research evidence to come up with a clinical decision. The amount of facts that are required has increased exponentially, but the human cognitive capacity hasn't done so. So huge amount of information, as there are so many students, they would know that they have to basically divulge and learn a huge amount of information in health sciences education. Traditionally, what has been happening? They were basically didactic teaching. We were trying to stuff or provide the knowledge to the student mainly through didactic means of lectures, which has led to a very heavy burden. Like this very European cartoon of stuffing the geese, we have been trying to stuff the students with the content knowledge. As it was very appropriately illustrated by Thomas Huxley, an eminent educationist, the burden that we face on the students is far too heavy. I'm sure the students will agree. And it takes some doing to keep them from breaking the intellectual back. And to add to that, I'm sure many of you are aware of the forgetting curve. After listening to a lecture within 24 hours, 80% of what we have learned is gone unless we revise. So however much we try to stuff the student, we are basically facing an uphill task. So what are the strategies? How to do it? First of all, we can think of a conceptual framework, an overlapping three-circle model with roles in cognitive neurosciences, teaching best practices, and psychology, all coming into play to answer this very important question. From educational psychology, the theory of constructivism, there are important aspects: arousing the learner interest, stimulation of prior knowledge, structuring and organizing knowledge, schema activation, and learning in context. I'll come into details very soon. Basically, it is all about meaningful learning. As content experts, we are very fascinated by facts and figures. However, if there is no relevance and meaning for the learners, it doesn't mean much in teaching. That is what we call contextual learning, And schema activation is how this knowledge is arranged in our brain. For example, this doesn't make any sense. Just facts and figures, perhaps. Still it doesn't. Still not. Because isolated facts, but the connections are not clear. Now it's becoming a little clearer. The connections have become clearer. And with the context put in, it becomes much more clearer. So that is why contextual learning and schema activation is very important. And again, the cone of learning, reading, we retain only 10%. And we retain only 30% of what we see. But if we do, or if we teach someone, simulation, practice-based learning, even a presentation, retention is much higher. So therefore, if we want to make learning more effective, bearing in mind the forgetting curve that we have seen previously, we have to go for a range of teaching learning methods. That's again based on the educational psychology. Neurosciences again plays a huge role. Current theory suggests if we want the learning to be more effective, activate as many components in the brain as much as possible. The psychomotor part, the visual part, auditory and emotions. Also, how the brain processes information. There's a huge amount of research evidence that is available. We have to think about the memory, the short-term memory, long-term memory, where the activation of previous learning is so important to activate long-term memory. And how information is retrieved. That is where making relations and connections between different content areas. So, we have to consider neurosciences as well as education psychology to answer this question. And how to do it? Whatever interesting methods that we use, the final outcome should be based on what we want our graduate to be, the outcomes. What are the qualities of the graduate that we want? So, our approaches should be based on achieving the final outcomes of the curriculum. Clinician, communicator, teamwork, so on and so forth.